Welcome back. May is Stroke Awareness Month, and for most of us, when we think of a stroke, we think of someone older being affected, but surprisingly, stroke can affect anyone, even the smallest children, without problems or very much warning. In fact, in many places, today is Pediatric Stroke Awareness Day, and one Knoxville family wants their story to serve as a message of awareness to everyone. Every week you can find 10-year-old Andrew Franklin kicking and punching as he masters the art of Kung Fu. But his lessons aren't just about having a new hobby or learning martial arts.
Even the days when he's crying, I tell him he can't stop. He's got to do more.
Kung Fu is giving him his mobility back.
It was very slow. It was slow progress until he started Kung Fu. And once Daniel took over, it's amazing what he's been able to recover.
What Andrew has had to endure is the true definition of beating all odds.
He couldn't focus, nothing. And my husband told me to, it scared him. He's like, come here, I can't get him to talk to me. And I went in there and I sat him up, and he was just looking through me. And I'm like, Andrew, what's wrong? And he just kept looking through me, and he stopped crying, and he just sat there. And he laid back down, and he started whimpering again. And so I pulled him back up, and I was like, talk to me, buddy. And he started vomiting.
Andrew was rushed to Children's Hospital, and after hours of testing, doctors ruled out several major issues.
Because I remember the doctor coming in and saying, well, I have good news. He said he's not had a stroke, he doesn't have a tumor, and, we didn't see any issues with bleeding.
In an effort to find out exactly what happened, an EEG and MRI were performed. That's when they discovered he was indeed one of the 3 out of 100,000 children that suffers from a stroke each year, specifically an ischemic stroke. That's when a blood clot is lodged in the artery of the brain that controls movement and speech.
In a normal artery, there are 2 arteries.
In this case, time was imperative, so interventional radiologist Dr. Keith Woodward was called out of major surgery to review Andrew's case. The problem, he had never performed this procedure on a child. In fact, it's so rare that a child would need this procedure that Dr. Woodward ran into one challenge after another.
All the devices that are made to treat ischemic strokes to try to remove the blood clot from the brain are made for adults, and the arteries in adults are about twice the size of the arteries in Andrew's, and so some of the devices that I normally use I was unable to use in his case. And so I was really pushing the limits of technology to try to get this done.
Without hesitation, Dr. Woodward performed the surgery using the smallest catheters and balloons, successfully reopening the artery.
I just knew he was going to be okay. God told my heart he was.
After spending some time in ICU, Andrew was allowed to return home. However, life was very different.
He had to relearn everything. I think the information was still in his brain. It was just his brain had to create a new pathway in order to get the information out.
After months of rehab, Andrew could walk, talk, and had much of his mobility back. But it appeared he had reached his max until January, when he started coming here.
He's now able to basically hold it up to where it's like level high, and he can hold it up in the air and keep it up longer than he used to. And then also with his right leg, he can now take his leg and kick straight with it.
While the reason for Andrew's stroke is still an absolute mystery, Andrew's mom, Christy, knows her mission and plans on using Andrew's story to make sure that message gets out.
I feel like this happened for a reason. He is perfectly healthy, but I think, God gave me this gift.
Dr. Woodward has since had one other patient with that same diagnosis as Andrew. However, sadly, they passed away 3 days after their stroke. Symptoms for a stroke can vary widely in children. If you would like to learn more about stroke in general and specifically pediatric stroke, just head to our web channel, volunteertv.com.
It's great to see